Well, the Alzheimer's Association is hosting a panel discussion online later today to share new research, how the pandemic has impacted access to care, and why early detection is so important for patients and their caretakers. Some of the things researchers have been focusing on are biomarkers, imaging, and possible blood tests to detect dementia early, and ways to slow the progression.
Anything you can do for the heart is good for the brain. So staying physically active, eating well.
But much is still unknown about dementia and Alzheimer's. Dr. Brittany Allen, neuropsychologist at Cox Health, says by the time signs and symptoms start showing, the brain has already been changing for 15 to 20 years. And that's one reason why Kristen Hilty, care consultant with the Alzheimer's Association, says early diagnosis is crucial.
I hear this from families a lot. Well, it's just dementia. There's not a lot we can do. It's just part of getting older. And a lot of people feel like, well, I really don't know for sure that's what it is, because I think, many years ago, we weren't 100% positive that someone had Alzheimer's until they died. But now our physicians are able to make a diagnosis with about 95% accuracy on what type of dementia you have.
Hilty says you want to be medically screened to rule out reversible causes of dementia. Dr. Allen says those can include medication side effects, depression, thyroid function, vitamin B12 deficiency, and diabetes, among others.
Those conditions can cause cognitive impairment, but they're very treatable.
With early diagnosis, they say families can begin to cope and be involved with decisions about care, which can lead to better quality of life for both the patient and caretakers.
So you will be the one that will be making choices and plans for your future. You'll be able to tell your families what you want. That's been proven over and over to me with families when they come to me early. I feel like the results and the outcomes are so much better for those families because they've had time to prepare for it.
As of today's panel, Dr. Allen and Hilty will be talking about that and what families need to know about what screening looks like, what to ask doctors, and of course more specific details about the latest research. The panel is happening at 4 p.m. today via Zoom. It is free and open to the public, but you do have